on. Thank you so much. Steph, do you let me know if our guys online can't hear me? Thank you for the introduction, and I really appreciate everyone's understanding that at your last meeting, I bowed out like the day before. I am now an able-bodied, for the most part, person in front of you, but I really, you all know about injuries and unexpected things, so thank you for that. I'm going to try to kind of get through the beginning start of our slides rather quickly, but part of it is just a little bit of understanding about why the heck am I sitting in front of you, who is a victim specialist, and why does the FBI respond to some of these things and not others, and so forth. So, am I not doing this? All right. So I'm going to do an overview of the Pulse nightclub shooting, which I had the honor and the privilege to work with the victims and the families of that terrible incident. But again, I just want to go over a few of the quick things. Disclaimer, literally changing PowerPoints is like an act of Congress sometimes in the federal government. So sometimes you may see some things up here and wonder, that does not make any sense, or that is not quite exactly what you're talking about. Well, the reason for that is I would literally have to get every single slide reapproved. So I brought a handy dandy cheat sheet for things that I want to make sure I cover with you guys on each one, and it may not be on the slide, but we're going to talk about it. So just bear with me in that regard. So the FBI plays a primary role in mass casualty events. Any terrorist attack is the responsibility of the FBI to investigate. However, we've had a lot of active shooter type cases, and not all of those will be FBI-led responses. Some of them will, some of them won't. A lot of them end up being an agency assist, where the FBI is involved just to provide some of our resources and people, to be honest with you. As we all know, during any incident, it brings together tons and tons of agencies. Who are victims of crime? I get this a lot. So victims of crime are anybody who has suffered a direct emotional or financial harm as a result of a crime. So, for example, during the Boston bombing, most people think of the victims as those who received direct impact, right, from the explosion. But victims were also a lot of the businesses in that area that suffered damages or were not able to work for a very long period of time during that scene. So we work with all victims of crime. Obviously, some have more needs than others. For the healthcare communities, victims may be people transported to your healthcare facilities, or they may be people who present in outcare setting, outpatient care settings. So we'll talk more about that soon. Why is the FBI involved? Well, we actually are legally mandated to be involved. Victims of federal crime are legally entitled to certain rights and services, and what that falls under are identifying victims, obtaining contact information for the victims or the next of kin so that we can notify them of their rights and allow them to act on those rights. We have to provide certain information and assistance at the earliest opportunity. Of course, updates throughout the investigation and personal effects, which we'll talk about. And you guys may not think that that impacts you in this room a whole lot, but it does. HIPAA. Okay, who in here knows HIPAA? I would assume everybody is going to raise their hand. Does anybody know if, in a mass casualty incident, if your establishment can provide information about the victim to law enforcement? Go ahead, just type it. Anybody? I hear some yeses. Do most people think it's yes? Do we have some people who think no? Okay, see, mostly yeses. That's the correct answer, but that's typically not what people think, right? And that has been the part of our largest struggle with law enforcement and the healthcare communities working together in partnership, so it's great to have these coalitions. I've listed on here a number of the ways that HIPAA covered entities can disclose information to law enforcement. But really the biggest thing is, as you guys know, there are very specific guidelines and provisions in there. And what we're going to get to is actually during the Pulse nightclub shooting, the mayor requested that HIPAA be waived. And that was not, the HIPAA was not waived. None of that ended up going through the White House because there's provisions within it that made it that completely unnecessary. But we'll talk about why he asked for that and why it wasn't needed. Victim assistance capabilities, I'll talk about this kind of in the work that I do, so I'm going to skim over this. We have enough time. But one of the number one things a lot of people don't realize that our program provides is emergency funds, so federal emergency funds. We have regular emergency funds, and then we have terrorism emergency funds, essentially fairly similar in how they work, just different pools of money. One of the cool things about them is none of your taxpayer dollars go to fund those. They are allotted by Congress, and in my entire program, when I deploy all of my assets, everything is covered by offender fines and fees within the Department of Justice, which is kind of cool. But our emergency funds provide some incredible resources that people don't realize. It provides transportation and lodging for families of injured victims to be able to sit by them at bedside and offer emotional support. We clean and return personal effects so that you're not giving a bloodied item that's of great value to the family in its original condition. And of course, different types of emergency clothing, food, and lodging. You see on there what is not covered. And the reason those are not covered is we're going to go to the next slide, and that is every state has its own crime victims compensation program. Is anybody familiar with that here in Washington? Okay, awesome. Couple hands. So all victims of crime are eligible to apply, and once they've applied, that type of program provides services for mental health counseling, their medical costs, potentially loss of wages, or the loss of support. And so that is also a payer of last resort. You typically will go through your insurance first, right, and all those other payers. But that makes it so victims don't end up having to pay out of pocket. And that is something that I do with victims. I help get them set up with those referrals. All right, so I'm going to go through these, like I said, quickly so we can talk about the meat and potatoes that you guys are wanting to hear about. But a lot of people get really scared after these an incidents happen, and they're not sure what to do. They don't know how to work with the victim. They're not sure what to say. But I've got to tell you, the victims and the family, if you are encountering them, what they will be talking about, what they'll be worried about, and everything falls within these 4 guidelines. Involvement, what happened? They want factual information in a timely manner, right? They want to know what's going on. Same with the family. Victim accounting. The victims want to know, where are my loved ones? Where are my friends? Who survived? What is their condition? And of course, the families of the injured or the deceased, they want to know where their loved one is as well, right? Access to resources and information. Who's going to help me with financial and logistical things? How am I going to get access to this information? Who's going to tell me? That type of thing. And of course, personal effects. So again, fundamental concerns of the family. What I think was really interesting is where the victims are pretty standard, more basic. The families are the ones that are already thinking about the mental health piece, right? The crisis counseling, more of the logisticals. They're wanting to exercise the legal rights. The victims aren't even thinking about that, right? They're just glad that they survived, if they survived, or whatever blessings that they can pull because they're trying to find meaning. That's where they're at in that moment. So very similar, but a little bit different. If there's a deceased victim, the families, of course, they want to know, how did you identify my loved one? Was it through sound practice? Am I going to be able to see them? And when are you going to be returning my loved one to me? Let me go through. Alrighty. Sorry. I think I have something on here that I wanted to share, but otherwise we're going to skip on. Oh, one thing that's really important. So under the criminal investigation may delay or limit our ability to provide information. When law enforcement officials are working with the different healthcare entities that are providing services, a lot of the frustration is, right, that they just have this simple question, why aren't you answering it? Why aren't you answering it? It's causing this undue anxiety. The reality is, and we're going to talk a little bit more about that, they can't for a number of reasons. And I don't know if any of you saw in the news today, but London is really upset at the U.S. for leaking information related to the attack there with different images. And I don't know if you guys saw that, but there was backpack images of the explosion. Well, the reason that a lot of this information could be shared but isn't at that moment is we identify victims through certain very specific pieces of information that only the people who would have been present would know, right? And we're going to talk about that because you would think that there's a lot, everybody just wants to do what's right, but there's always scam artists out there, and that became prevalent in what we're here to talk about today. So the Pulse nightclub shooting, as a victim specialist with the FBI, I provide direct services to crime victims in Washington and Idaho here. But I'm also a member of our victim assistance rapid deployment team. So we are trained folks throughout the entire country, and we're on teams that are ready to deploy to mass casualty events. And under that membership is how I ended up deployed to Orlando. So that there is Pulse. As most of you are probably aware, there were 49 fatalities and 53 injured in that incident that occurred on June 12, 2016. There were 315 people inside the club. And a little bit of the dynamics is that it happened to be Latin night. So 90% of everybody in attendance were from a Hispanic background, and very few of them were English speaking. Of course, there's the LGBT component. If you don't know what that means, that's okay, but I'll be referring to it. So that's lesbian, gay, bisexual, transgender, and queer. Okay, so that the Pulse nightclub, I don't know if many folks are aware of this, but the owner, her brother died of AIDS in the 90s. So she opened up this club so that it would be a remembrance of him and the things he liked the most, dancing and music. And of course, Pulse was the deadliest mass shooting by a single shooter and the deadliest terrorist attack in the United States since 9/11. So just a brief overview. One thing I want to interject with, are we okay on the mic? Okay. Okay. If we need to switch, just let me know. As we go through, if you have a question about something, I want you to raise your hand and ask right then and there. I'll have time at the end for questions, but please don't wait, because if it's relevant to where we're talking about, I'm going through these as friends, and so it most likely will be applicable during that time if it's kind of related. Okay. So I think it's inappropriate to have these conversations without remembering why I'm here talking about them. So these are the faces of the victims, our deceased victims at the Pulse nightclub. And you'll hear as I go through, I will never use the shooter's name, and I try not to refer to him often because I think media sensationalizes these events, and we all too often focus on that. So I just want that kind of disclaimer to be there and for us to take a second to look at these beautiful people. All right, our timeline. Oh, actually, let me go back. So you see a very diverse group of folks, right? So for those that are interested, not only was it Latino night, but 50% of all of the victims, both deceased and injured, were actually from Puerto Rico. There was 3 from Colombia, 3 from Mexico, 4 from the Dominican Republic, and 2 from Canada. So a very diverse group of folks. All right. I put up the timeline typically when I'm presenting to law enforcement groups, but the reason that this is important for your group is our operational psychologist always trains and teaches us, if you've seen one event, you've seen one event. They are all so different, and Pulse in particular was so different. Most of the mass casualty responses I've gone on have been incidents that are contained relatively quickly. But in Pulse, as you can see here, this entire ordeal occurred over 3-hour time span. And so what that meant for the response is that so many more people were brought in. And what do I mean by that? Well, our shooter called 911, and a lot of the victims inside during the entire incident, they were calling their family, they were calling their friends, but they too were calling 911. And some of them were calling the hospital. So, right, when you think about emergency response, it's not just some of the very basic who we identify as key players. Everybody needs to be involved in what that plan is, because dispatch and the people answering the phone to the hospital may get one of these very important calls and need some help trying to figure out what that looks like. Because this is such a huge city and such a massive event, I wanted to kind of bring it back a little bit more local to us. So by comparison of why these factors are so significant to the response that we provide, during the Umpqua Community College shooting in Roseburg, Oregon, the police showed up in 2 minutes, and that entire incident occurred in less than 10 minutes, okay? So not minimizing that by any means. This is not apples and oranges, but right, very different from lying there, some of them bleeding to death for 3 hours, versus an event where they were able to seek emergency medical attention within 10 minutes. The other big difference was that within 1 hour, an Umpqua Community College shooting, they had a family evacuation and assistance center already set up. For this incident, and we'll talk about the Family Assistance Center, it took a few days because of the scale and the magnitude. And so that delay in services really put the medical community in a place to be providing a lot more psychological first aid and attention than in other type of incidences. Okay. So a lot of times people have heard these terms, open population. What's difficult about victim identification in an open population is on an airplane, right? You've got a passenger manifest, so you know essentially who boarded that plane. You know who your victim population is going to be. In an open population, it could be Joe Schmo, right? Anybody could have come and gone. It's hard to figure out exactly who was there. So how do we identify victims? We identify victims through their injuries and through interviews. Sorry, guys, just a minute. All right. I tend to have a loud voice, so for the people on the computer, hopefully this helps them. But if I'm shouting at you, give me a sign, okay? I mean it. All right, so talking about victim identification, this piece is so crucial. So we've got this open population, and we are identifying folks, right, through interviews and through their injuries. And the injuries in this particular case were substantial, and so we were relying a lot on this medical community, like in this room, to help give us and identify those people, what their needs were, and being able to formally identify them and offer them services. I don't know if anybody has heard presentations on the Boston bombing, but victim identification and providing a collaborative response is so crucial, because during the Boston bombing, there was an unfortunate incident where 2 participants came together and they essentially put both of their IDs on the one person, right? And I don't know if you ladies or men in here, but especially when I was in college, if I went to a bar, we threw all of our stuff all in one bag because no one wanted to carry it around. So this population here at Pulse is very challenging because people had IDs on them that were not theirs, or they didn't have an ID at all. And what happened in Boston was that this particular gal came in with her friend's ID in her pocket. Who knows what happened to her ID? But ultimately, the family of her friend is actually the one that died. And so they received a death notification and their daughter was actually alive. And the exact opposite happened for the other family. They were told their daughter was in emergency surgery. They see her after. They bring her into the ICU, and that is not their daughter, right? Those are easy mistakes that can happen, but devastating for the families, absolutely devastating. So victim identification is incredibly important. Fatality management, I don't know if anybody is here in that population, but I know sometimes there are. So I just wanted to let you know the autopsy is completed by Orange County Medical Examiner's Office, and they completed 50 autopsies within 3 days. Ultimately, they did all 49 of the victims in 2 days, and the shooter on the 3rd day. And that was done by 7 medical examiners in total. And all of those results were released in early August. Of the autopsies they did, well, obviously all of them, there are over 200 gunshot wounds. It just gives you an idea of the magnitude. Death notification. Oh my gosh, if you can just do one thing for me, I would be so grateful. Everybody in this room, there's no reason any of us should not have death notification training. But by a show of hands, who's had any? Okay, I see 2 hands. Who is given a death notification? I'm sure actually a lot more people in this room have given a death notification, whether it be that somebody close to you has died and you had to tell your husband, wife, children, right? If I say that, put it that way, how many people have given a death notification? A lot of you. So when there is an incident of this magnitude, death notifications are crucial because if they're not done right, that is the words, the who, the where, all of that, that is what is imprinted on that family member's memory. They will never forget it. So it should be done well. And unfortunately, in the healthcare community, it's not often taught, not to our doctors, not to our nurses. So if you go to Penn State, go to Google and type in Penn State death notification. The FBI and Penn State partnered and put together a very brief death notification training. And it's open to anybody. You're welcome to do it right online. And I highly, highly encourage you to do that. And the reason for that is, in this instance, death notifications were provided by the agents and the victim specialists like myself who partnered and teamed up. But there weren't enough of us, right? And you don't want to delay these very long. And so ultimately, a lot of healthcare professionals were forced to have to give those notifications, but they didn't have training. And I'm not saying that they didn't go well, but that provider would have probably felt a whole lot more confident if they'd had some foundation underneath them. So do me a favor, check it out. Family considerations, and then we'll move on. One of the biggest takeaways that I had from this was that the LGBT community had some unique family dynamics going on. And the biggest one is biological versus chosen family. So when it came to victim identification, who you give the death notification to, who gets to decide what emergency medical treatments and so forth are occurring, we had a huge conflict because a majority of our victims were actually quite estranged from their families. They didn't have support. Some of them hadn't seen or talked to them in over 10 years. But of course, these things bring people together, right? So they're there and they want information. Meanwhile, their partner for the last who knows how many years, or the individual they've had children with or are cohabitating with, they're the ones that want to be there. And so that became very, very tricky. In addition, I mentioned that there were 53 injured victims. There was way more victims than that were injured, but a good number of them delayed medical treatment or didn't get treatment at all because they were not out to their family. And they knew that if they said they were there, being a predominantly LGBT nightclub, even though not everybody there was gay or lesbian or any of the combinations, that they weren't willing to put themselves out there. So I had people come and ask for victim assistance, and I would notice things on them, and they would have shrapnel or bullet, like when a bullet like grazes you. Sorry, I can't think of the word now. But a number of injuries that were never treated. The other big concern was there was a number of individuals who had HIV, and they were afraid of their family learning of this diagnosis. So our non-hospitalized victims, a lot of you guys in here that work in outpatient settings, this is so important. We need to start educating our outpatient facilities on identifying victims. After the Boston bombing, the majority of the people who participated in that event were not from Boston. A lot of them went back to their respective cities and received treatment there. And a lot of them weren't afforded timely access to information or services because they weren't identified until much later. So just keeping that in mind, that they may have decided, right, where's my safety net? It's definitely not here. I'm going home. I'm going to my doctor. And that essentially prolonged them from being able to have a lot more services and things that would help them with recovery. We talked about the importance of identifying victims. I'm not going to beat a dead horse, but let's get into the response piece. All right, so our first responders, I would never be able to do what they do. And there is obviously a substantial role for them. But victim assistance in our healthcare community is actually the ones that carry the burden, the largest burden after a mass casualty incident in a response, because the needs are long-term. And so once an incident has been contained, once a patient has been brought for medical treatment, they're done, right? I mean, the effects aren't complete, but we're all the ones that are trying to deal with those things long term. And typically, that's the part that is not spent or is most neglected when it comes to planning. So to talk a little bit about some of the medical part of the response management, which I know you're all hoping for, 44 patients were brought to Orlando Regional Medical Center. They were located less than a half a mile away from the incident. And essentially 9 patients died there. But what's really pretty incredible is they had just done a mass casualty drill and exercise. And of course, no one likes to have to go through training and those drills and exercises. We all grunt about it, right? But they were all so grateful that that had happened, because essentially the 9 that died there were essentially fairly, for the most part, dead on arrival, right? And so all 35 victims that came in and that were treated and released, which was a huge success on their part, right? And they said it was purely because of all their planning. 12 others went to Florida Hospital in Orlando. But to kind of talk about what that response looked like, 35 gunshot victims showed up in the first half hour to Orlando Medical Center. I'm just going to abbreviate that because it's easier. And one of the things that they had done is they put in an alert, and they took staff from 2 other area hospitals to respond to Orlando Medical so that they didn't have to move any of their critical patients, or really any patients at all, to other facilities, which is really pretty neat that they did that. And then they operated under Code Black, so anybody who is not a patient affiliated with the Pulse Nightclub shooting was diverted to another hospital. So that is some of the ways that they managed that incident and response. A little fun fact, does anyone know that the hospital never charged any of the victims for any of their medical treatment? So that's another part of the response management piece. Of course, somebody made that call, but that ended up, I believe, about $5.5 million in unplanned expenses. And then from a selfish standpoint, one of the best things for us as a crisis responders was that most of the victims were contained to one medical facility. And so I know that we don't always have control over that, but when you're trying to provide consistent services across the board, having people primarily in the same location really helps. During the Boston bombing, they were at 35 area hospitals. You can imagine that the timing and the dissemination of services just didn't look the same. So I put that out there. We might not get control of that, but that was really helpful. And then as far as victims receiving assistance, we had a victim specialist like myself at each of the hospitals. And initially, when the victims were first brought in, there were 5 individuals at Orlando Medical Center. So ultimately, that took the pressure off the staff, off the social work. Anything that could be responded to by us, we were able to do and meet with them. Communication. I know everybody in this room knows when we do exercises, comms is the most annoying part, right? It's the biggest weakness that we can all identify every single time, communication. But one thing in this room to expect delays, expect that things aren't going to happen the way you anticipate. This incident occurred so close to Pulse Nightclub that they, essentially the alert system never made it to the hospital before victims started arriving, okay? The other thing was that 30% of all the casualties were transported actually by the police and not EMS, and they were transported in truck beds of either police vehicles or personal vehicles. And the reason for that is, unfortunately, the scene was not stable, and so EMS couldn't get close enough. And ultimately, what does law enforcement do? We're very, well, I'll have that joke later, but we are not as organized as our EMS and firefighter partners go. And that being said, they did not have time with the volume to provide, try to stop any of the bleeding or do anything of that sort. They were literally just putting them into a truck bed, bringing them to the hospital, and allowing the nursing team to start to take over from there. Because of the diversity in this group, language barriers was a huge issue. So we don't have necessarily the most diverse population here in Spokane, but sometimes there's events that bring other people. And I think as we continue to grow and expand, that may be something we need to consider, because that, even though Orlando sees a lot of Hispanic folks, there was a huge delay in our services because it was hard to communicate and be able to provide them equal services. The LGBT dynamics and documentation. So for the transgender victims, one of the barriers that we had was, the hospitalized ones, was that no one ever thought to ask them how they identify, right? And so you do want to document what their legal name is, but to be able to have people trust and feel committed to their care and have the best long-term mental health prognosis, we want to be meeting them where they are. And that's as simple as, you know, what gender do you identify by, and what would you like me to call you? And putting that somewhere in the face sheet, so when we're interacting with them, maybe their name, you know, is Carol on paper, but they want to go by Johnny. Well, we should be calling them Johnny when we're able to do that. So that is one big thing that a lesson learned. And then another thing that the hospital was really overwhelmed with was elected officials and celebrity visits. That needs to be a part of all of our planning. Expect that the president is going to show up. Expect that the mayor is going to show up. Expect that celebrities are going to show up and do so unannounced. And not everybody finds that very respectful. So after the initial crisis, and you've gotten over that, it's important for those people caring for them to ask them ahead of time, if we have people that are here that would like to visit with you, what are your wishes? Because you will not have time when they show up. So she was a delightful gal when I was staffing the Family Assistance Center. Jamie Lee Curtis comes in with this huge entourage, right? But there was no planning or preparation. I'm literally standing there. I know that lady. I don't know how I know her, because right now everything is escaping me, but oh my goodness. And she just starts coming in and hugging people and going through. And you know, it was very well received, but I'm going to tell you that it's not always. And so be prepared. Have that in your plan of how you're going to deal with it. All right, most important. Okay, so the Family Assistance Center, it took a few days to get this set up, but the Orange Bowl is held right here in this arena. And this is the most robust, absolutely incredible Family Assistance Center I've ever had an opportunity to be a part of. It was absolutely incredible. I'm going to tell you a few key features about it so you see why it was so amazing. And part of that was that there was tons of parking, right? And they're used to big events and security. So the city of Orlando lent us all those people who'd already been cleared to do security on the perimeter. They helped direct the parking flow in and out. They helped make sure that people that were meant to be there were allowed in and others were not allowed in through their typical security screening. And then what would happen is somebody who had the ability to triage them on another level would meet them and bring them up to the second floor where we had our reception area. During that time, we're talking with them, and that became incredibly key because, like I was telling you before, there's always scammers. I can't tell you how many people showed up pretending to have been involved to try to seek free services. We had to kick out a lot of people, but this method gave us kind of a buffer so that the people who were there and there legitimately didn't have to see and deal with that type of thing. So on the second floor, you see how right here there's like this gap kind of underneath here? These are suites, air-conditioned indoor suites. And there was an open air area, a large one, right about here. And so on the second floor, we had a reception area where they did their intake. And then they were brought into the air-conditioned area, and I'll show you what that looks like. But what was absolutely incredible was that there were over 765 volunteers, and that's not the people paid that showed up. Over 1,000 people were served, and that equated to 298 families. This particular Family Assistance Center was open for 8 days, and at any given day it had 25 to 40 plus agencies. And I say 40 plus because there were times that there were even more. The times we had less were typically on the weekends when some of the agencies weren't open and weren't able to staff. But you can see there all the different types of people who were there. They did not miss a beat. This was a one-stop shop, which was absolutely incredible. And then once they closed down the arena for the Family Assistance Center, they opened up the Orlando United Assistance Center that is still open today. And they're dedicated to keeping it open for as long as that is necessary. So that was kind of a unused building that they converted. So really pretty cool. So this is the inside of the Family Assistance Center. I apologize, but this is all I have for photos that I can share. But right here is the outdoor area, reception area, that we would get them signed up. And then they'd be met with an advocate that would come through here. These are all just open tables where this area all had food and water. They could take a break at any time, go sit at the table, take a break, take a rest. But ultimately, all of these, where you can kind of see numbers on the perimeter, these are all the different agencies that were represented. And so they got brought around to each one of them that was applicable to their needs. This over here was Red Cross. Restroom, of course, very important. And then this is our child care area. For the people who needed crisis counseling or an interview by law enforcement, we then personally escorted them up to the 3rd floor so that it was private. We then used a smaller little ensuite to do all of those very individual, which turned out really, really nice. I don't know if we'll all get this opportunity, but if I ever had a need to be at a family assistance center, I hope it looks like this. So that's a really good question. They were I kind of skipped over the communication part of it. They were doing briefings, multiple briefings a day. And at the time, there was also a 1-800 number and a website. So people could communicate and go online to provide assistance or to look up different providers on their website. But until the Family Assistance Center became implemented, which was after the 3rd day, there wasn't a place for them to all gather. But it's a great question that you asked, because the number one benefit to a Family Assistance Center is it really creates unity amongst the families. It gives them a safe place to come together and to grieve and to process, because obviously most of them don't want to be alone and they want access to questions. You need something else? Okay, just making sure. I know I'm running over my time, so I'm going to try to speed up here. We only have a couple more things. Personal effects. The reason I bring this up is because in some instances, not everything is done the same, right? The medical examiner has some personal effects. Law enforcement has some. EMS has some. The hospital has some. You name it. And it all gets dealt with differently, and things get lost or misdocumented. And so they did a really good job in this case, in that all of the medical examiner and the hospital, all the items that were taken off of the patient were provided to law enforcement, and they were logged the exact same way in order to streamline getting those items back. And I know, so a lot of you might be thinking, it's really not important. But I got to tell you, next to where is my loved one, this is the second most vital question. Why? Because it's the last thing that their loved one touched. The last glimpse of what happened or what their day was like before this terrible tragedy. And they want every piece that they can possibly have back. And so this is a huge, huge undertaking. As you can imagine, car keys were lost or thrown about. And so from the healthcare perspective, really making sure that the diligentness of getting those things, putting them all together and getting them to the appropriate people so you don't have to be the ones to return those, or making sure you're collaborating with victim assistance so that we can have them cleaned and processed and returned back. A perfect example was during the Sandy Hook case. There were bloodied lunch boxes, and law enforcement routinely doesn't do anything. They have them in a paper evidence bag, they're taped up, they bring them, they open it, right, because they have this chain of custody, and they give that back to a family. But we all know that that's not the right way, and so what we do in those instances, we have it clean, we have it prepared, oftentimes, put into a nice box or what have you, and then presented to the family, which is far more, well received than being able, receiving something as tragic as a bloody lunch box. I don't think any of us would want something like that. So this is a really crucial piece that I think a lot of people forget. So just if we're ever in this type of situation or we're planning, we need to be talking about personal effects, how we're going to handle that. All right, last two slides, and I will get through these quickly. Lessons learned, tracking and accountability of resources. There was a slew of agencies there providing incredible things. flights, hotels, you name it. One of the problems, we weren't documenting well enough what was given to who. And because we had that biological family versus chosen family, you best believe that people showed up pretending that they were the closest person ever, taking the $500 gift cards from Red Cross and then peacing out. And that is not what these things are intended for, right? We are trying to help supplement and support these victims. So we need to have a mechanism of how, when we get these agencies together, how are we going to track and show what has been provided? Same with setting clear guidelines. The airlines were absolutely terrific, but one of the deceased families I dealt with, there was a deceased and an injured in their family network, a lot of split families. The airlines alone for that one family gave them over 50 round-trip tickets because the rest of the family kept showing up, kept showing up, kept showing up, and they did not realize that they'd already provided to this family, right? So at some point it gets to be helping, and then there's another point that we're enabling, and we're not doing a service because it wasn't just, it wasn't equitable across all lines. That being said, Florida Sunshine Law, we need to start talking to our legal experts about what our laws are here. The Florida Sunshine Law totally ripped the carpet from underneath us. We had a face sheet during the registration when people came into the Family Assistance Center, and on that we would check boxes of the different places that they needed to go be connected with. And we thought that that was a great way to streamline, since there's this huge Family Assistance Center, where they needed to go throughout the day, right? Wrong. This Florida Sunshine Law allows for everything, any government document, and the City of Orlando is a government, to be complete public access. So we quickly had to do a lot of redacting. And the reason I bring this up, and it was so crucial, is can you imagine, I myself would have never in a million years, knowing the repercussions, would have marked on there HIV AIDS clinic if I knew that those were going to be public documents. I do think we got around that, but holy heck, lesson learned, right? Or I put on there, because it's important information, not out to family, right? That tells you what type of level of support. Can you imagine if that gets out? It'd just be devastating. Huge, huge lesson learned. And then again, the LGBT community, just that, I told you I would mention about the mayor. The mayor requested a waiver of HIPAA because in some states, same-sex marriages, they will, in the hospital, they will not provide them any updates or information. And he was afraid that that would happen. It was not necessary because under HIPAA, you can have special close friends. So that is null and void. That should never happen, but it does. And so that's why that happened in that instance. And there was just a lot of considerations. You know, you just never, you can, and you plan and you plan and you plan, and you'll never have everything planned out. But this is really my last slide, and that is everybody I talked to, from the medical team to the first responders, it was all about preparedness. Preparedness is important, but more than preparedness is drills and planning, because without it, you won't fall into a rhythm. It won't happen that way. Planning for family assistance, the hospitals were really surprised, and they said that the one thing they're going to start doing, because none of them had it in their plan, was to implement and very early on address family assistance and family members, right? And the media, because as you know, they're going to begin swarming an ED in a hospital. And in an event like this, where it's 3 hours long and there's so many people impacted and they're not getting death notifications, guess where they're going to be? At the hospital. Another reason that a family assistance or evacuation site is so important is because if you have that, that's where the families will converge instead of the hospital. So that it's so, so important to have an area that they can be accommodated and managed to control the chaos, because otherwise it gets entirely out of control. The media staging area, just when the hospitals felt like they had things under control, that's when the community vigils and memorial services and funerals started. And because of so many people not getting access to medical care, the hospitals and the outpatient places, they all had representatives staffing those events in the event that, you know, somebody was collapsing or there was some type of untreated injury. So it continues. Same with blood donations. The community wants to help, and within hours of the incident hitting the news, people were showing up to donate blood. That's amazing, right? We need that resource. That's another thing we need to plan for. is how are we going to handle those types of things. And then, of course, critical incident stress management for the employees. If you don't have a plan or know how to get that, it's absolute must. The employees need that. And then lastly, access to hospital. Gail, you talked about a million ways you knew to get to work. I love that because access to hospital. Does anyone know the big difference between firefighters and police officers? It's okay, you can be derogatory. Just kidding. Okay, so firefighters that show up all nice and organized, they park their truck, they get all their things out, their hoses and everything. Everything is completely equipped and you know, A plus B plus C, right? Or goes, it's in order. Law enforcement, they drive in like that's out of hell. They're parked all over the sidewalk and the lawns. They don't care. They get out. Those cars need to be towed because now they've blocked all the access. And it is complete mayhem. Their heart's in a good place, right? But that does not help us so much. Well, because the incident was so close to the hospital, Orlando Medical Center called in over 500 individuals to help surge this trauma response. And the entire blocks were barricaded, right? People did not know how to access the hospital. Now, we can't predict where the event is going to be, but around our hospital facilities, it'd be really helpful if we talked about if there's an incident close to us, how can we at least have a plan so that the law enforcement will know, right, that this is the easiest way for our people to park and have access, and have a couple ideas for that, because it will happen. And then what makes an even bigger cluster a bigger cluster? You've got a whole bunch of trauma docs that are like, screw it, I'm parking here, I'm running up. And then we have all of these cars that we have to tow to get out to let people get in. So that being said, planning, partnerships and planning are crucial. We can get through those types of things if we're talking about them, having a plan for them, if we kind of have a general sense of who each other's faces are. So I appreciate all of your time. I think we are out for questions, but if we have a few that I can answer quickly, there's just so much when it comes to this response. All right. Thank you guys for your, oh. Maybe. It depends on the area. It depends, and it honestly does. So I'm one person for 3/4 the state of Washington and Idaho. I try to get in front of as many people as I can at any opportunity, like now. Thank you, Travis. But the reality is I can't really get to everybody. And so really what it comes down to is having relationships like I've established with Cindy. So at least there's a few that are there. And typically what ends up happening is those small relationships become so much larger because of one phone call. And in an incident like this, Red Cross and emergency management plays a huge role. Really, the city of Orlando is who created all of this. And how did they do that? They had those plans in place. They actually had a listserv. And so as soon as this happened, the mayor basically said, send it to everybody. We want all hands on deck. They listed out all the people that they would ideally like to have, never thinking in a million years that they'd have this turnout. Every single airline had a representative booking flights right then and there. Every major hotel had a representative making travel arrangements. One last thing, because that reminds me, an unintended consequence. Orlando is a huge tourist destination. A lot of places have fireworks. There was a lot of chaos and confusion in this incident because the victims initially, because of all the strobe lights and things, thought that the gunshots were in the song or fireworks. Well, because of the proximity to all these theme parks that have fireworks almost every night, including the hospitals, can you imagine how triggering? We had no idea until a victim 3 days later said, I can't handle it anymore. And then we requested that either the people who were close to them be moved to new hotels and that the fireworks were near the hospitals be ceased for a little bit because it was. Anything else?
Great, thanks, Jessica.